Good morning, JMU nursing students, RN nursing students. It's Mrs. Timalonis. I thought it would be time for a video message. It is about mid-semester and there's been a lot going on with your work, so I wanted to give you some feedback and encouragement. Hope you're all doing well. It's been a crazy weekend. We had to put a beloved German Shepherd down, and many of you know that's not easy to do. But it's Monday morning and we're starting over, and we'll get through the week one day at a time, 1 minute at a time, 1 hour at a time, however it takes. So as far as the upcoming week assignment, the drill is you have a case study, cardiac case study, and on your case studies, remember to practice your PQRST or your old carts, whatever you use, to make sure you're thorough with your collecting your subjective data. And then you have a pulmonary and cardiac assessment where it's just a physical exam. Even though you have the complaint of chest tightness, there's really no collection of subjective data. So the focus is on your objective data. Now, many of the things you'll be doing and practicing on your exam, you'll be doing in your final video exam. So here's what I suggest. I suggest that you start making a script out. Take that form that you have to follow, that guideline for your final video exam, and start writing a script. Pretend you are going to be an actor or actress on a stage, and you're going to have your lines ready and you're practicing your motions and your actions and your performance. So every time you have one of these assessments that you have to write up, you should be using a partner to practice on, and hopefully the same partner that you'll use to do your video. But start preparing. That's the whole purpose of all of these write-ups, is to stage your practices so that you're ready for that final one and you've done it a couple times. Believe me, I know this. I've taught undergraduate health assessment for many, many years, and I actually did a video for the students demonstrating whole head to toe assessment, and it had to be done in 30 minutes. And that's what I had to do. I had to write out a script to make sure that I was on time. I had to practice it with the volunteer student, and it just doesn't come off the cuff like you would in the hospital or wherever you're practicing, because you're being videotaped, and that always adds an element of anxiety to it. And you want to do it correctly because you're doing it for a grade. So that's my advice to you. And lastly, I want to talk about some of the questions that I have been asked about the assignments and so forth. Some of the wording of the questions may not be what you're used to, but I think what I can infer is there's a little bit of conflict about your role or your scope of practice as a nurse, and what some of the responses or suggested responses to the question seem to be focused more medically oriented. Now, this is a course that is for RNs to BSN, and so I think the course is challenging to you, and especially to your way of thinking as a nurse. For example, when you're being asked to list interventions, many of you are very much sticking into your nursing interventions and using your nursing diagnoses. But as you work in the collaborative world, I think this course is challenging you to push that a little bit. And if you are uncomfortable stating things outside of your scope of practice, then I suggest that you say, well, ask the doctor to order this test, or ask the doctor to order this medication. I think that we as nurses need to be a little bit more assertive and make recommendations to the physician. A lot of times the nurse knows more than the doctor, and I'm sure you will agree with me because he or she is with the patient all the time. And I keep thinking about that SBAR. Many of you are familiar with situation background assessment recommendation. That last letter, the recommendation, is really you making suggestions to the doctor. So you are thinking about what should be done. Culture should be collected, x-ray should be done, this test should maybe need to be ordered. And so you may want to start approaching some of your responses as interventions from that perspective. Okay, again, you're all doing a great job. You're all thinking. You're having some growing pains, I would say, but I know you are learning. I know it because I see the improvement every week. And ultimately, it's up to you to take the feedback you're receiving and to decide what to do with that. Not just grade oriented, but practice oriented. When I am particular about what you're documenting and how it has to be precise and things like that, I sent you that big announcement last week about documenting like a lawyer is picking apart your notes. That's very serious, and that is something that you have to think about. And many of you, when you stated what your expectations were for the course, I don't think many stated that I want to learn how to document better. So you are learning new languages in which you can look at a person and just say, instead of say they look fine, you can say their smile is symmetrical, there's no facial drooping, you know, the shoulder shrug is strong and even bilaterally. I'm thinking back to the head and neck assessment. Please always, if you have any questions, shoot me an email. I can Zoom with you or make a FaceTime call if you prefer that. I know there is something lost with email communication. So I empathize with all of you for your growing pains, but I also applaud you for all of the good work you're doing. Okay, keep moving. It's mid-semester, halfway there. Take care. Bye-bye.